One. Danielle?
Good morning, everyone. Thank you so much for stopping by to visit my presentation on It's Just Sugar, right? I want to talk to you today about basic information about diabetes. I'm going to walk through, let me do my disclosure slide. I'm disclosing that I am an employee and I own stock of Novo Nordisk, and also I own stock with Walgreens Pharmacy drugstores. Today, I'm going to talk to you about diabetes. So, diabetes 101. Also, how do you manage your diabetes? Talk to you about some of the complications that could occur with longstanding diabetes or unmanaged diabetes. And we're having a pandemic, right? Actually, a twin pandemic. But we're going to also talk about, well, COVID-19, diabetes, and race. And then I'm going to just give you a little bit of information about what is the state of diabetes here in our state of Arizona. So let's get started. Diabetes. Diabetes is actually a disease that occurs when your body can no longer produce its own insulin. Um, and this is a chronic illness. There is currently no cure for diabetes. So sometimes you might read in the headlines, um, person lost 100 pounds and cured their diabetes. Currently, there is no cure in diabetes because of the actual way the disease state is. It's damage to the beta cell, so your pancreas. And right now, the amount of damage that goes from the small amount of regrowth would never equal out to actually repair that damage. Now, diabetes can lead to serious health problems. And this is why it's important to know what your diabetes is, know your numbers, and know how to manage it appropriately. And hopefully, at the end of this conversation, you will be able to know all three of those things and more. So, let's talk about the various types of diabetes. We're going to start with type 1. Now, type 1 is not very common. It's about 5 to 10% of all people who have diabetes have type 1. It's generally seen in a younger population under the age of 20, although you can develop type 1 in any age, but we're talking in general terms. And this is actually where the insulin that is needed to reduce the blood glucose sugar is not even being produced. And so this is important to know because you have to have insulin to treat type 1 diabetes. It does not mean if you have type 2 diabetes and you're on insulin therapy that you have type 1. So insulin in itself does not dictate whether it's type 1 or type 2. Type 1 is actually an autoimmune disease. And what does that mean? That means that your body is actually attacking the cells in your pancreas. And that's what's requiring you to have to take insulin. Some common symptoms, and you'll see these symptoms also across other types of diabetes, is weight loss, loss of energy, so feeling like, oh, I don't want to do anything, increased thirst. So you drink a lot of water or liquids, and then you go to the bathroom a lot, and you don't think much of it because you're like, well, I have been drinking a lot. So, of course, it makes sense that I have to go to the bathroom a lot. But this could actually be a problem, especially if it's happening very frequently. And then there's gestational diabetes. And gestational diabetes does not mean that you've had diabetes and now that you're pregnant. It actually means that you've never had a diagnosis of diabetes before. You become pregnant and you take a test. It's usually diagnosed, this test is usually diagnosed around the 24th week of pregnancy. And it usually never goes away until after delivery. But you take this test, and your obstetrician says you have gestational diabetes. And why is that important? And why is it important to do? It's important for you because about 9% of all pregnancies actually are impacted by gestational diabetes. And your risk of developing diabetes, type 2 diabetes later on in life increases almost by half within 10 years of being diagnosed with gestational diabetes. So this is important to know, and you want to make sure that if you are currently pregnant, that you make sure that your doctor is checking to see if you have gestational diabetes. Now, something else to consider is that I talked about within 10 years that about 20 to 50% of individuals will go on to develop type 2 diabetes. But a small percentage, 5 to 10% of women actually continue to have diabetes, even though the baby's been born. So it's important to keep your eating habits under control. I know you always think, oh, I'm expecting I can eat for two. Maybe not so much. Stay healthy when you're pregnant so that you can reduce your risk of developing gestational diabetes. Type 2 diabetes. Now, this is the most common. And so when you hear people talk about having diabetes, this is probably the one that most people are referring to, type 2 diabetes. And this is about 90 to 95% of all the classifications that we talked about falls in this group. Now, most people are over the age of 40 when this is diagnosed, but what we're seeing today is that children younger and younger are actually developing type 2 diabetes as young as 10 and 12. And usually, mostly all of that is due to excess weight. Um, Now, a large percentage of type 2 diabetes is actually preventable. And how do you prevent type 2 diabetes? We're going to talk about that a little later when we get to pre-diabetes, but you want to make sure that you're doing some type of physical activity because that physical activity can reduce the insulin resistance. That's a big word, right? That insulin resistance in your body. So that big word just means that it blocks sugar that's floating around in your bloodstream from getting into your muscles. But when you exercise, now that's making your muscle cells more acceptable of that sugar. And so it pulls it out of the blood and pulls it into the muscle where it's needed to be able to help you live a healthier life. Now, again, we talked about those symptoms in type 1. They're pretty similar here: increased thirst, increased urination, feeling tired. We're also going to add in the blurred vision. Maybe you've had a sore and it just hasn't seemed to heal, and you're not, I'm doing everything I'm supposed to do. Why is this not healing? This is common actually in individuals who have high levels of blood sugar and hence type 2 diabetes, where their wounds take longer to heal. So these are some signs and symptoms to consider as you're moving forward and trying to be healthier and more checked in to your health in 2021. Now, we talked about diabetes type 1, we talked about gestational, we talked about type 2. Now let's talk about pre-diabetes. Oh, I'm sorry. I don't know all my thoughts. Let's talk about the risk factors of type 2 first. Risk factors: overweight and obese. This is huge because this is one of the single things that you have control over to help reduce your risk. Things like family history, you have little control over. History of gestational diabetes, you have a little control over. Getting older, you have no control over that. Although there's a lot of people out there trying to sell you things to make you make you think that you do, but you don't. Ethnic background, being African American, Latinx, um, um, Native American, Asian American, these also increase your risk. And guess what? You don't have control over that. The two things that you have control of, where you can take control of your health, is maintaining a healthier weight and moving around, getting in some physical activity, and not being just a couch potato. What do we know about African Americans in this arena? Well, we know that African Americans are almost 2 times as likely to have diabetes than non Hispanic whites. 2 times. That's significant. And what are some myths that we know? Well, it's possible to have just a touch of sugar. That's a myth. There's no such thing as a touch of sugar. You have diabetes or you don't, one or the other. Another common myth is people with diabetes need to follow a special diet. That's a myth. People with diabetes benefit from a healthier diet or eating healthier foods, but everyone does. Everyone does. And we talked about using that as a way of a preventive measure against type 2 diabetes. Another common myth: you have to lose a lot of weight for your diabetes to improve. That actually is not true. Only about 5 to 10% of your body weight, which might be 10 to 15 pounds, can significantly improve your blood glucose levels, your blood pressure, your cholesterol. So these are all myths that we're going to turn into facts. And so now when you hear those myths in our communities or at our circles, or sitting in our family village, you take the initiative to set them straight, give them the facts. Now, every 17 seconds, someone in the US has been diagnosed with diabetes. I don't know if Daniel's still in the background, but maybe he can do a calculation for me. I hope to talk for maybe another 20 minutes or so. Maybe he can calculate to see by the end of my presentation how many people have been diagnosed with diabetes. That's his homework assignment, if he's still in the background. Let's talk about prediabetes. Here we are. It's estimated that over 84 million people in the US, adults, have prediabetes. What is prediabetes? Prediabetes is just like it sounds. It's what you have before you actually get diabetes. So it's this level of your blood sugars being higher than normal, higher than they normally should be, from being under where you would be diagnosed with diabetes. So that's that little gray area of having prediabetes. Before a patient actually gets type 2 diabetes, they've almost always had prediabetes. And how do you know if you have prediabetes? You need to ask your physician. And if you haven't been checked for prediabetes, which most clinicians will do, if you haven't been tested for prediabetes, ask to be tested. Or you could simply just take a risk test. The American Diabetes Association has a risk test for type 2 diabetes. And that can kind of give you a rough estimate of maybe are you at greater risk for developing prediabetes. It's important that you take control of this when you can before you actually get diagnosed. Why? Because having type 2 diabetes is just like having cardiovascular disease. It actually puts you at the same risk of illness and death as having a heart attack. Now let's talk about how are we going to manage our diabetes. This is the fun part. So having a diagnosis of diabetes does not mean that there's a death sentence or that, oh, I'm automatically going to go on insulin. Or once I get on insulin, I remember my grandmother, she started taking the insulin shots, and then she died like a year later. This does not mean that because you're on insulin that you are at risk of dying. What we know is that there are health disparities in our communities, and that sometimes maybe grandma was not getting the attention or care or even the access to care that she needed. And by the time she ended up on insulin, she was already in a bad situation. So having to have to take insulin does not mean that your end of life is there. So let's talk about how do we manage it. So now you have a diagnosis of type 2 diabetes. What are you going to do? Well, it's not as challenging as you think, but it does take some work. Your healthcare provider will and hopefully does check your A1C level. Now, what is the A1C? A1C is a simple test that your physician or clinician will do, usually on a quarterly basis, so maybe 3 or 4 times a year, to see how, on average, you're doing with keeping your blood glucose levels in a normal range. It is an average. It's an average of about 2 to 3 months. And what that average actually is telling your clinician is that whether or not you're doing pretty good with your blood glucose levels as a whole, right? Overall. But what's even a better marker is if you're checking your blood glucose levels daily. That's actually where you're going to get the information you need and your doctor needs to kind of manage some other things in your life. Like every time I eat this piece of pizza, my blood glucose level shoots up. Well, that could tell you maybe you need to stop eating that piece of pizza or eat half of it. And then maybe if you eat half, you can test again to see what happens. But checking that blood glucose level on a regular basis will be able to help you understand better how to manage your day to day activities with type 2 diabetes. So we talked about the A1C, that average test that will happen. Well, what does that A1C need to be? The American Diabetes Association recommends that the A1C should be under 7%. So remember that number, 7. A1C, 7. So now when you hear a clinician talk to you and say your A1C is 7, you know what that means. There's another body called the American ACE, the American, let me see what that stands for again. American, I'm drawing a blank, I'm so sorry, clinical endocrinologist. They recommend that your A1C is under 6.5. So depending on whether you're seeing an endocrinologist or a primary care clinician, they might have different ranges for you, even outside of 7. Depending on what your current health condition is, your healthcare provider might say, I want your A1C to be around 8%, which is higher than 6.5 and 7, but it might be just where you need to be based off of your current health situation. Now, along with management, so again, we talked about eating a healthier lifestyle. We talked about getting in some physical activity on a daily basis. We talked about checking our blood glucose level. So let's say we check our blood glucose level and it's high. Should you be concerned? You should be concerned. And maybe you don't have time to check it, but you start noticing those same symptoms that we talked about prior to being diagnosed, right? Frequent need to urinate, increased thirst, blurred vision. That could give you an indication that you are out of control. Your diabetes is not being managed. Now, then there's this other side, the low blood sugar. That's the hypoglycemia. Some people might always say, I go low. So not Michelle Obama low, this is a different one. The low blood sugar, and that's a typo. That shouldn't be hyperglycemia next to that. I'll make sure to change that. You might have symptoms of feeling dizzy or sweating a lot. You might get hungry, or you're having problems paying attention. I mean, we all sit on these Zoom calls so much, we might have a little hypo going on right there. You might have a rapid heartbeat. These are some common signs and symptoms that you might have low blood glucose level. When you have these signs and symptoms, I request that you take your blood glucose level because it would confirm whether or not you have high blood sugar or you have low blood sugar. If you have high blood sugar, that may mean that did I miss my medication? Um, what are my eating habits doing? Do I need to change those? Or my drinking habits, right? Am I drinking too much soda or pure fruit juice? You need to start to figure out what's going on there. Or if you have a low blood glucose level, that's when you want to do that rule of 15. You want to take, and these grams or carbs are going to sound a little crazy, but 15 grams of sugar, and we'll talk about what that means later. And then you want to check every 15 minutes to see if it's starting to go back to normal. If it's continuing to stay low or go low after about 3 checks, then you need to get yourself to the emergency room. But we'll talk about that in a moment. Now, remember, we want to test our blood sugar at least once a day, if not more, depending on what your clinician has recommended. You want to take your medications as prescribed. If you're taking it once a day, twice a day, 3 times a day, please take it as you're directed. You want to follow your provider's recommendations for eating healthier meals. You also want to get some physical activity in, right? It doesn't have to mean you got to get a gym membership or run a mile every day, but you do want to get some physical activity in. And please, if you're a smoker, stop smoking. This is absolutely a requirement for you to do better with managing your type 2 diabetes or diabetes in general or your life in general. Do not smoke. And if you're having a hard time quitting smoking, that's okay. We understand that to be the case a lot. Reach out to your healthcare provider. They have solutions for you. I'm going to briefly just talk about diabetes complications. Why? Because I can go into great detail, but that would take longer than our 30-minute time span. So overall, there's several different types of complications. Blindness, diabetes is the leading cause of blindness in the US. Kidney disease, extremely prevalent in the African American community. We end up on dialysis. Nerve damage, that's actually when you start to feel like tingling in your fingers or toes. And that's usually due to poor circulation. Amputations. Diabetes is one of the leading causes of lower limb amputations in the US. Heart attack, strokes, so heart disease is common with diabetes because I mentioned to you before, having diabetes puts you at an equivalent risk of having, like you had had a heart attack. But the common ones to keep an eye out for the blindness, we talked about the blurred vision, right? So that lets you know right then and there that high levels of glucose is affecting your eyes. The heart disease, we talked about stroke, high blood pressure, and then also the loss of sensations in your toes and feet. Look out for that, right? Because if you don't pay attention to that, you might wind up having to end up getting a toe or a foot or even a leg amputated. So it's important to manage your diabetes. If I can implore anything on you today, it's to manage your diabetes. Now, let's go over a little bit over to our pandemics that we're having, right? Our twin pandemic. We have COVID-19 and we have yet again social inequities. So let's discuss that and how it relates to diabetes. Now, this is a busy slide, and I apologize, but I tried to highlight what's most important. And these slides are available to you in the resource center on this website. So, diabetes. People with diabetes are not at higher risk of getting COVID-19. It does not mean because you have diabetes that you are more likely to get COVID-19. But what it does mean is that once you contract the virus, you are more likely to have a serious complication from it. So, if you have type 2 diabetes in general, we're speaking generally, you might have more severe symptoms and complications once you get the virus, or if, I shouldn't say once, if you get the virus. Your risk of getting sick um, from COVID-19 is likely to be lowered if your diabetes is well managed. So, hence why we need to manage your diabetes. And because you have diabetes, you might have other conditions like high blood pressure. You might have bad cholesterol issues. So, when you have these multiple different types of chronic diseases or complications, it actually increases your risk of having severe symptoms from COVID-19 because it's harder for your body to fight the infection. So, these are things to consider, and yet another reason why you need to appropriately manage your diabetes. Now, people with type 1 or gestational diabetes might be at an increased risk for severe illness. The information that came out regarding these two types of diabetes is still very young and it's not really validated yet. But again, just across the board, diabetes puts you at a greater risk for severity. This was a study that was done in Metro Atlanta at actually one particular hospital. And this hospital actually did some data to see that in a month's time, the individuals that were hospital, African American descent or African American, they wanted to see what their percentage of being hospitalized from COVID-19 was in compared to their white counterparts. Well, you'll see here that 79% versus 13% African American versus white were hospitalized when they actually developed COVID-19 or came in COVID-19 positive, I should say. Now, why is that important? It's extremely important. So now you're like, oh my goodness, now it means because I'm Black, I'm going to get COVID more often. No, you will not get COVID more often. Because you are Black, you might be in some other situations. Social determinants of health might actually put you at greater risk, but not having the brown skin complexion does not put you at greater risk. Well, what does? Well, things like being an essential worker. Maybe you're in a lower wage job than your white counterparts, or maybe you don't have any paid time off of work. So this actually increases your exposure to the virus which then indirect or directly increases your chances of developing the virus or getting the virus. And then in addition, diabetes, having excess weight, and high blood pressure. So these are all very important. Um, Common tips for becoming, sorry, I can't see the part of there, but common tips. If you're getting sick, you want to drink lots of fluids. Make sure you drink lots of fluids. You want to follow that 15-15 rule, which means you want to eat 15 grams of a simple carb that's easy to digest. So, like honey, jam, jello, popsicles, juice, orange juice, things like that. And you want to check your blood sugar every 15 minutes. And I said, if after 2 to 3 hours or 3 times or so checking it, if it's still low, get yourself to the hospital. And I just want to let you know that if you are checking your blood glucose level and maybe you have taken a Tylenol as a fever reducer, sometimes the Tylenol might impact the levels that you see. They might actually come back higher. So check your user guide to see based off of your actual individual um, CGM. Now, what should you do to be prepared? Well, there's several things you need to do because we saw when we had that 2 weeks, sometimes almost close to a month shutdown here in Arizona, some people weren't prepared. So, what do you need to do to make sure that you remain prepared during this pandemic? Have your phone numbers of your doctor and your healthcare professional team, your pharmacy, your insurance company. Have a list of medications and the doses that you're taking, including over the counter medications. You want to also make sure that you have those simple carbs around the house, just in case you do have hypoglycemia. And you want to make sure during this state of emergency that you have extra refills on hand of your prescription in case you're unable to leave the house. And you want to make sure if you have insulin that you have enough insulin for at least 2 weeks, if not more. And then gather extra supplies like rubbing alcohol or soap so that when you have to check your blood glucose level, you have them. And then make sure you have glucagon or ketone strips to also be able to help you manage your diabetes. And then have enough groceries in the home, right? So that you could at least sustain being indoors for at least 14 days. And then what about coverage? Well, if you have Medicare, and I won't go into a lot of detail around this, you actually have this slide. If you have Medicare, you actually do have the ability to get tested at no cost to yourself. And if you're hospitalized, you don't pay that cost. You might be responsible for any deductibles or copays that you have, but that should be covered under Medicare. Now I'm coming up on the end and so of my time, so I'm going to kind of go a little quickly here with diabetes in Arizona. But the prevalence of diabetes in the state is 10.9, so about 11%. In diabetes in Arizona, diabetes is the seventh leading cause of premature death. 1 in 10 adults live with diabetes in Arizona. 1 in 3 Arizonans have prediabetes, and they don't even know they have prediabetes mainly. And if by the CDC has, I'm sorry, not the CDC, Arizona DHS has estimated by 2050, there could almost be 12 million people here living in Arizona, and nearly half of them could actually be affected by prediabetes and diabetes. That's significant. And then there's communities at risk here in Arizona, African American, Native American, Latinx. Again, we see that across the US. Um, Individuals who have excess weight. We talked about disparities, whether it's social, economic, or other disparities, and individuals who just have low access to food, being able to exercise, things of that nature. And then some other facts. Well, there's 15 counties here in Arizona, and all of them have food deserts, or what I like to refer to as food apartheid. Risk of death is about 50% higher for adults with diabetes here in Arizona. And then if you were able to get all the people living with diabetes in one area, it would be large enough. It would be as large as the city limits of Tucson and Flagstaff combined. So what do you need to do? Remember, medication is only a small part of treating your diabetes. You want to follow a healthy meal plan. You want to stay active. You want to regularly check your blood sugar levels. You want to take all your diabetes medications as prescribed. This is what you need to do. And if you need help, you have a medical professional to help you through this process. You don't have to do this alone. And with that, I'll end my presentation just a little bit over the time I had. So thank you for your patience. And I'll open it up to just questions if I have time. Daniel, if I don't, no worries. I put my email here, health and wellness state of mind at gmail.com. If I'm unable to address your questions today, please feel free to send me an email and I will reply to you at my earliest convenience.
All
Thank
right.
you so much.
Great job, Danielle. And we do have about 5 minutes. So there was a test. I didn't realize there was going to be a test. So you said 20 minutes, 17 per minute, and that's 340
I said 17 per second.
per second. Oh,
So,
so
so
times
340 times
60.
6. Mm-hmm.
Right. Was that 2100? 2100 and something? I lost count. I'm sorry.
So that's
That,
a lot of people. In a
yes,
nutshell, that's a lot of people in the time that I did this presentation that have now been diagnosed with type 2 diabetes.
definitely.
Thank you
Do
for that. You get an A on your test.
Well, thanks. Yeah, I looked up and did that say seconds or minutes? All right. So, does anyone on the call have any questions for Danielle? She hit a lot of the frequently asked questions during your myths part.
Good.
That was pretty good.
Yes.
All right. Well, we are at 1:30. That gives me a chance to thank you once again,
Thank you.
Danielle. There is I had a script that I was supposed to read. I didn't realize that. So
Mhm.
I'm just going to kind of riff on this one. There on the website, there are different ways to get to other sessions, this and other sessions. Through the Hope and Help Room, you can get a lot of cool information about the different presenters that you have seen over the past 3 days, as well as videos from FIBCO and other sponsors. So, on behalf of this presenter, Danielle Gilliam, and myself, Dan Watson Bay, and the FIBCO family, I want to thank everybody for coming, and we are out. All right, guys, take it easy.
Thank you.
Thank you.